Hey, welcome into the conversation. It is your host, Adrienne Lawrence. And today I am joined by the co-founder and CEO of Hey Jane, which is one of the first digital abortion clinics. Thank you so much for joining us, Kiki Freedman.
Thank you so much for having me.
Yes, Kiki. So, this digital abortion clinic, I'm guessing, is this something new that's been sparked with the reversal of Dobbs, or is this something where you got out ahead of the action before the Supreme Court decided to go rogue?
It is something that we've been working on for a while, and before the fall of Roe, the idea came about in the summer of 2019 when I saw the final abortion clinic in Missouri, where I'd gone to school, nearly get shut down. So it sort of seemed that the writing was on the wall, that things were trending in a very dark direction. It seemed dystopian at the time to imagine one state with no abortion access. And of course, that's become quaint in retrospect, but we started fortunately working on it before this more recent urgent need came about.
And it's so incredibly cool, in part just because I like telehealth. I love medicine coming to my door as opposed to me having to go to hospitals or go to facilities or to deal with other people in the outside world. So to know that people can get this healthcare service as it concerns abortion via this digital mechanism, that is amazing. What did you have to do in order to get this in place for Hey Jane?
Yeah, so the first step was really just setting up our medical protocol. We know that these medications are incredibly safe and effective. The abortion pill has been approved for more than 20 years by the FDA. And so we just had to make some small changes to make it compatible with the telemedicine model. And then getting the word out, making sure that people know that this is an option. We saw even before Roe fell that more than half of abortions are done with the abortion pill. And yet today, still only 1 in 4 people know the abortion pill is an option. So we want to get the word out, make sure that people know this is a safe and effective and really important choice that many people can make.
Yes, and I know this is a powerful game changer for not a lot of people out there who may find themselves in a situation where they do need an abortion. And so if they are seeking your services, how does it work? Do they need to have health insurance? Can they just go ahead and submit a request? Fill us in.
Yeah, it's super easy. Patients will come onto our site. They'll get lots more information about what the treatment is, how it works with Hey Jane. They will do an online intake. They could do that 24/7. So after work, when the kids are asleep, whatever it might be. And within one business day, one of our really experienced and sympathetic providers will get back to them to confirm their prescription if appropriate. The medication then gets shipped to an address of their choice, usually their home, as quickly as overnight. And then throughout, they'll have access to on-demand support, clinical, but also emotional and social at the tap of a button to make sure that they're very well taken care of. In terms of insurance, we price at $249. That's less than half of the national average. And we do partner with some really wonderful abortion funds who can help offer financial assistance.
That's fantastic. That's really great that you have other mechanisms available for people who may not necessarily be able to afford it, but also that you're out there making it cost effective, because the reality is that especially in this time, it can be very difficult for people to absorb another cost. And so to make that accessible in terms of the abortion pill is absolutely fantastic. And I know right now that, there are a few restrictions in that the company, Hey Jane, that you're only really shipping to what? Colorado, Illinois, New Mexico, Washington, New Jersey, California, New York, as they're the only states that allow telemedicine?
There are several states that allow telemedicine abortion, and we hope to be in all of them soon. We started with some of those larger states, and we'll be expanding quickly from there.
All right, fantastic. So there are more states out there that do allow it, right?
There are 19 states that have sort of preemptively banned telemedicine abortion, but many of the remaining are viable, and so we hope to get to them soon.
Yes, I hope so as well. I'm just so glad to hear that there are more than just the list of the ones, which I completely understand and very much appreciate how you've started, especially California, New York, some of the states that are most populated. I think that's fantastic. It allows you to reach a number of people. And it seems like also these states happen to be the ones that are most supportive in terms of abortion rights, which is also significant, even though it is incredibly unfortunate that we have so many states that we're still trying to get them to recognize our healthcare. And as far as I understand it, I know teleabortion, you said it was banned in about 19, 20 states in terms of getting that access. Do you know what's holding it up? Is it because they do have a larger legislation on the table that just outright kind of bans abortion or completely restricts it?
Yeah, so many of the states, as you might imagine, are those that have now implemented full or essentially full bans since the Dobbs decision came down. Most of them are just based in, of course, non-scientific beliefs around how the treatment works in order to withhold access to what is essentially what is essential healthcare.
Oh, it's completely unfortunate. Hopefully there will be change at some point soon. But we're very fortunate to have organizations like Hey Jane out there that can provide people with quick access. And so when it comes to public response, when you tell people, hey, this is what I run, Hey Jane, it's one of the first digital abortion clinics, what kind of response do you get?
So far, we have seen such an incredibly positive response. I have to say, I'm very grateful for that. I think people can slip into feeling a little bit hopeless right now. There's a lot of really bleak news out there in terms of the direction that access is moving. So I think being able to see folks innovating and trying new ways to approach, this unfortunately old problem can give, a bit of a bright spot within the broader ecosystem.
Well, that's great. I think it's something that we very much need. Although, hey, if anything's going to fuel people going into the midterms to vote blue and hopefully vote in a way that truly does make this Rovember, I will encourage that without a doubt. And so in terms of what you're doing with Hey Jane, is there something on the agenda coming up next other than trying to get into other states?
Yes, so our big focuses now are on finding ways to continue to expand access. Geography is a big part of that, and financial accessibility is a huge component as well. Finding new ways to both lower everyday cost and then partner with payers and other really important means of creating new channels for low cost access. We've also found that the complete care model that we provide that does integrate this holistic clinical, emotional, and social support has been incredibly well received by our patients. We have patient satisfaction scores that are 10 times higher than the healthcare industry average. And so finding ways to potentially apply that model to other really underserved healthcare treatments that would benefit from this holistic support is something that's on our radar as well.
Well, that's wonderful. It does sound like you are expanding care options for people who need it, especially with these states out here trying to curb people's access to healthcare. And something I was wondering if you all had potentially considered it, because there are these larger organizations that are situated perhaps in states that can't necessarily get full access to abortion. If there is the possibility of having some kind of partnership with them where you're not in a position where you necessarily have to ship to a state where it's illegal, but even if you were to provide some kind of access or opportunity by way of partnership with these organizations or these companies in terms of the care that they are able to provide their employees.
That is such an important point. I think one detail that's often confused in this conversation is that it is still legal for residents of hostile states to get care in friendly states. We've seen states like New York and California, New Jersey go so far as to explicitly say, we will protect access for out-of-state patients who need to travel to our state. And so working with employers or other organizations within those hostile states to ensure that folks can get really convenient, fast, and affordable care once they've crossed those state lines is essential. It's of course ridiculous that patients need to go through those hoops in order to get care, traveling across state line to access essential healthcare. But we hope that given those constraints that exist, we can make it as easy as possible.
Yeah, you're right. It is absolutely ridiculous. But hey, if an employer can foot the bill, whether it says, okay, we are going to have you go to our New York office, and it so happens there's a pill waiting for them, that's not a bad idea. Sounds like a good setup to me. Yeah, whatever needs to be done to get people this opportunity and this access. All right, so we only have a few more minutes left, but I would love to know when it comes to Hey Jane, what is the message that you really want people to receive when it comes to the services that you're able to provide and also what you stand for as an organization?
Absolutely. Well, the timing of our conversation is serendipitous. September 28th is International Safe Abortion Day. And so we feel it's important to just reiterate that abortion is necessary for bodily safety. We know that patients denied abortion care are 4 times more likely to be in poverty, significantly more likely to be in abusive relationships, and 14 times more likely to die from carrying an unintended pregnancy to term. So sustaining abortion access is necessary to safety in and of itself. And we now have these really wonderful options like medication abortion and telemedicine to sustain that safe access moving forward.
Yes, indeed. And that's a very powerful thing. And so again, very grateful for Hey Jane and the other organizations out there looking to hopefully dismantle this limited access to abortion care. As we know, it is healthcare and it should be something that all people can access. This is a humanitarian issue. This is an issue of people's healthcare, welfare, and we really need to focus on that and hopefully institute the change that is necessary. All right, so for those out there who are interested in Hey Jane, whether it's supporting the cause or maybe getting access to abortion themselves, where can they go? Where should they go to get more information?
Check out heyjane.com or on Instagram or TikTok at HeyJaneHealth.
Fantastic. Thank you so much for joining us. That's Kiki Freedman, co-founder and CEO of Hey Jane.
Thank you so much for having me.